Chapter 3, Male Sexual Anatomy and Physiology. The external male organs include the penis and the scrotum. The penis is the male organ used in sexual intercourse, as well as a conduit for urine. The human penis contains neither bones nor muscle, although there are muscles that control urination and ejaculation at the base of the penis. Instead, the penis contains 3 cylinders of spongy erectile tissue which fill up with blood and stiffen during sexual arousal. The corpora cavernosa is the largest of the 2 cylinders. These fill up with blood and stiffen during sexual arousal. The corpus spongiosum is the cylinder that runs along the bottom surface of the penis. It contains the urethra, which conducts urine through the penis to the urinary opening or urethral meatus at the tip. The glans, or head of the penis, is extremely sensitive to sexual stimulation. It is separated from the body of the penis by the coronal ridge. The body of the penis is called the shaft. Unlike the clitoris, it is free-swinging, such that when it is engorged with blood, erection is obvious. The skin of the penis is hairless and loose, allowing expansion during erection. The foreskin is the loose skin that covers part or all of the penile glands. A secretion called smegma may accumulate below the foreskin, allowing bacteria to flourish. Circumcision is the surgical removal of the foreskin. It is controversial, mostly due to the fact that it is almost always performed on infants who are not capable of giving informed consent to the procedures. Reasons for circumcision include religious rites, prevention of transmission of sexually transmitted infections, a reduced risk of urinary tract infection or UTI, and a belief that it enhances hygiene. It is generally accepted, however, that circumcision lessens sexual sensations. The average length of the erect penis is between 5 and 7 inches. While men may consider larger penis to be a sign of manhood, women rarely mention penis size as an important element in their sexual satisfaction. The scrotum is the pouch of loose skin that contains the testes. Each testicle is held in place by a spermatic cord, which contains the vas deferens, blood vessels, and nerves. Sperm production is optimal at a temperature below 98.6 degrees Fahrenheit, so the testicles will raise and lower in response to temperature changes. The testicles will also change position with sexual stimulation. The male internal sex organs include the testes, the organs that manufacture sperm, as well as testosterone. Testosterone, which is secreted from the interstitial cells known as Leydig cells, stimulate the prenatal differentiation of male sex organs, sperm production, and the development of secondary sex characteristics. In contrast to the changing levels of female sex hormones, blood testosterone levels stay relatively level. The pituitary hormone LH stimulates the secretion of testosterone. As with many hormones in the body, the production of testosterone is controlled by a negative feedback loop. Rising levels of testosterone send a signal to the hypothalamus and pituitary glands so that LH secretion is reduced, thus decreasing the production of testosterone. Production of androgens usually occurs gradually over time. As men age, they see a decrease in sexual performance as well as in bone and muscle mass. While testosterone replacement therapy boosts energy, strength, and sex drive, before undergoing this treatment, men should consider the risks of increased prostate cancer and cardiovascular disease. Each testicle is divided into many lobes that are filled with seminiferous tubules. Through spermatogenesis, these thread-like structures produce and store hundreds of billions of sperm over a lifetime. Men have the ability to make sperm throughout their lives, from puberty to old age. It takes about 72 days for the testes to manufacture a mature sperm cell. Each spermatocyte, containing 46 chromosomes, splits into two haploid spermatids, which mature into spermatozoa. Spermatozoa have three sections. The head contains the chromosomes. The midpiece contains structures that provide energy for the movement of the tail. The haploid spermatozoa contains one pair of each of the 23 chromosomes. Half of the sperm contain this X sex chromosome, and half contain the Y chromosome. Oocytes, or eggs, in the female only contain an X chromosome. Therefore, men determine the sex of the baby. When combined with the 23 chromosomes of the ovum, the fertilized zygote will contain the standard 46 chromosomes. The vas deferens. Each epididymis empties into a tube called the vas deferens, which lies near the skin surface of the scrotum. The vas deferens serves as a conduit for mature sperm. When the vas deferens is severed during a procedure called a vasectomy, sperm is then prevented from reaching the ejaculatory duct and leaving the body. So a man continues to produce sperm, but they just don't ever leave. The seminal vesicles are two small glands that are each about 2 inches long that lie behind the bladder and open into the ejaculatory ducts. They produce a rich fluid in fructose, which nourishes the sperm. The prostate gland lies beneath the bladder and encircles the urethra. The alkaline secretions from the prostate gland help the sperm survive in the acidic female reproduction system. Cowper's glands are two small glands, also known as the bulbourethral. During sexual arousal, they secrete a drop of clear alkaline fluid. Now, semen is not a synonym for sperm. Sperm and the fluids contributed by the seminal vesicles, the prostate gland, and the Cowper's gland make up semen. So sperm actually only accounts for about 1% of the volume of semen. The average ejaculate consists of about 3 to 5 milliliters of semen and between 200 million and 400 million sperm. Because the organs that comprise the urinary and reproductive systems are near to each other, they are referred to as the urogenital or urogenital system. Urethritis, or inflammation of the bladder and urethra, is characterized by frequent and urgent urination, burning during urination, and penile discharge. Preventative measures include drinking more water, drinking cranberry juice, and lowering the intake of caffeine and alcohol. Cancer of the testes is a relatively rare form of cancer, accounting for about 8,000 new cases annually, and about 380 men will die from it every year. It is the most common form of solid tumor cancer to strike men between the ages of 20 and 34, accounting for nearly 10% of all deaths from cancer among men in that age group. About 14% of men with testicular cancer had cryptochronism as children, a condition in which one or both testicles fail to descend from the abdomen into the scrotum. It is more common in men whose testicles fail to descend into the scrotum. Early detection is crucial to survival, so men should perform regular self-examination of the testes. So the prostate gland is tiny at birth. It grows rapidly at puberty and usually becomes enlarged past the age of 50. Some health problems that can occur is benign prostatic hyperplasia, or BPH. BPH is a non-cancerous enlargement of the prostate gland due to hormonal changes that are associated with aging. The prostate gland becomes enlarged in about half of the men past the age of 50 and about 80% of men by age 80. Another possible disorder of the prostate is prostatitis, which is an inflammation of the prostate and usually associated with painful ejaculation. It can be treated with antibiotics. So 1 in 6 men in the United States will develop prostate cancer. Prostate cancer is the second most common form of cancer among men and the second leading cause of cancer deaths in men. African American men are 50 to 60% more likely than European American men to develop prostate cancer. Age, testosterone, and the intake of animal fat are potential risk factors for prostate cancer. Early symptoms can include urinary frequency and difficulty in urinating. Later symptoms include blood in the urine, pain on urination, and pain in the back or pelvis. So prostate cancer is detected by means of a prostate-specific antigen, or PSA, blood test that's recommended once a year for men 50 and over and beginning at a younger age for men at greater risk. African American men are advised to begin getting PSA blood tests at around the age of 45. The American Cancer Society also recommends that men receive annual digital rectal examinations beginning at the same time as the PSA tests. So the next few slides, we're going to look at male sexual functions. So the male sexual functions of erection and ejaculation provide a means for sperm to travel from the male's reproductive tract to the female's reproductive tract. So an erection is an enlargement and stiffening of the penis. It occurs when the spongy tissue of the penis fills with blood, causing it to enlarge. Now, during an erection, the bladder gets closed off, so it decreases the likelihood that semen and urine will then mix. Erection is reversed when more blood flows out of the penis than flows in. So a man who fears that he will be unable to perform successfully may experience performance anxiety, which then prevents him from obtaining or maintaining an erection. Men have nocturnal erections approximately every 90 minutes or so as they sleep. This is considered a normal process. So interestingly, erection and ejaculation are spinal reflexes. They are automatic, unlearned responses to sexual stimulation. Erections due to direct physical stimulation involve a simple spinal reflex. Tactile signals from the pelvic region travel down nerves to the sacral spinal cord. This sends impulses to the genitalia, causing the dilation of arteries to the penis. Erections and ejaculation can occur due to tactile sensation in men with spinal cord injuries. The role of the brain can also initiate erections through visual images, memories, or even fantasies. These signals are sent to the spinal cord to initiate erection. The brain can also stifle sexual response. Now, as a man ages, it takes longer to achieve erection, and direct tactile stimulation becomes more necessary. So as we discussed earlier, erection and ejaculation are not voluntary. They are controlled by the autonomic nervous system. The autonomic nervous system also controls such automatic processes such as your heartbeat, your pupil dilation, respiration, digestion. And the autonomic nervous system is divided into two branches, the sympathetic branch and the parasympathetic branch. So the sympathetic nervous system controls your fight or flight response, your stress response. It mobilizes the body, gets it ready to expend energy for excitement and emergencies. The parasympathetic nervous system calms you back down. It is the rest and digest, kind of goes to business back as usual, and it activates your digestive processes to start working good again and slows down your heart. So while erection is controlled by the parasympathetic nervous system, sympathetic nerves control ejaculation. So there are a couple of erectile abnormalities that you need to be familiar with. An excessive curvature of the penis upon erection is called Peyronie's disease, and this can actually make erection painful. Priapism is an erection that persists for hours or even days. Now, this can be caused by diseases such as leukemia or even sickle cell anemia. It occurs when the mechanisms that drain the blood from the erect penis become damaged. So medical intervention then becomes required to reverse the condition to prevent any permanent damage. Again, as we mentioned earlier, ejaculation, like an erection, is a spinal reflex and involves the expulsion of semen from the tip of the penis. Now, orgasm and ejaculation are not the same thing. They are not synonymous. For instance, while some paraplegics can ejaculate, they will not experience the subjective aspects of orgasm, so they won't necessarily feel it. Conversely, prepubescent boys may experience an orgasm but not have an ejaculation that comes with it. So there are two stages associated with ejaculation. The first stage of ejaculation is called emission. Now this involves the contractions of the prostate, the seminal vesicles, and the vas deferens, which then propel the seminal fluid into the urethra. The second stage, the expulsion stage, then involves the propulsion of the semen through the urethra and out the urethral opening at the tip of the penis. So the muscles that are at the base of the penis contract and then expel the semen. Now this is the stage, the expulsion stage, where we generally associate with the sensations of an orgasm. So there are two different phases, the emission phase, which sends it into the urethral tract, and the expulsion stage, which then sends it out of the penis. Now there can be a problem with ejaculation. There's something called retrograde ejaculation, where the ejaculate empties into the bladder, it goes the other way, rather than being expelled from the body. That's generally caused by improper movements of the sphincters. Now, this can be due to prostate surgery, it can be due to certain drugs, illnesses such as diabetes, as well as accidents. It can also result in infertility, but generally it tends to be harmless.